Is it time to legalize euthanasia, also known as mercy killing? The debate around legalizing euthanasia is complex and multifaceted. Here are some key arguments in favor of its legalization. First, the right to die with dignity. Advocates argue that individuals should have the autonomy to choose a dignified end to their life, especially when suffering from terminal illnesses with no hope of recovery. Next, relief from suffering. Euthanasia can provide a way to alleviate unbearable pain and suffering for patients with incurable conditions. This can be seen as an act of compassion, allowing individuals to avoid prolonged agony. Then, personal autonomy. Legalizing euthanasia respects personal freedom and the right to make decisions about one's own body and life. This includes the choice to end one's life in the face of severe suffering. Healthcare costs are another point. Proponents argue that euthanasia can reduce the financial burden on families and healthcare systems by avoiding prolonged medical treatments that offer no hope of recovery. Quality of life is also a consideration. For some, the quality of life is more important than its length. Euthanasia allows individuals to avoid a diminished quality of life due to severe illness or disability. Lastly, psychological comfort. Knowing that they have the option of euthanasia can provide psychological comfort to terminally ill patients, even if they do not ultimately choose to use it. These arguments highlight the importance of personal choice, compassion, and respect for individual autonomy in the debate over euthanasia. What are your thoughts on this topic? The arguments against legalizing euthanasia are numerous and often rooted in ethical, practical, and societal concerns. Here are some key points. First, the sanctity of life. Many argue that euthanasia undermines the sanctity of human life. This perspective holds that life is inherently valuable and should be preserved regardless of circumstances. Then the slippery slope. There is a concern that legalizing euthanasia could lead to a slippery slope, where the criteria for eligibility might gradually expand, potentially leading to non-voluntary or involuntary euthanasia. Palliative care is another argument. Opponents argue that with proper palliative care, the suffering of terminally ill patients can be managed effectively, making euthanasia unnecessary. They believe that improving end-of-life care should be the focus instead. There is also the potential for abuse. Legalizing euthanasia could open the door to potential abuses, such as coercion of vulnerable individuals by family members or healthcare providers. This could lead to decisions being made for financial or other non-compassionate reasons. Moral and ethical concerns are significant too. Many religious and ethical frameworks oppose euthanasia, viewing it as morally wrong. For instance, some believe that suffering has a purpose or that life and death should be left to natural processes. Impact on the medical profession is another point. Legalizing euthanasia might undermine the commitment of healthcare professionals to saving lives and providing care. It could alter the fundamental role of doctors from healers to life-takers. Psychological impact is also a concern. There is a concern that legalizing euthanasia could lead to psychological pressure on patients to choose death over being a burden to their families or society. Lastly, regulation challenges. Ensuring strict and fair regulation of euthanasia laws is challenging. There is a risk that safeguards might fail, leading to unintended consequences. These arguments highlight the complexities and potential risks associated with legalizing euthanasia. What are your thoughts on these concerns? Different cultures have varied perspectives on euthanasia, influenced by religious, ethical, and societal values. Here are some insights into how different cultures view euthanasia. In Western cultures, for example, in Europe, countries like the Netherlands, Belgium, and Switzerland have legalized euthanasia and physician-assisted suicide under strict regulations. These societies often emphasize individual autonomy and the right to choose a dignified death. In North America, in the United States, euthanasia is illegal, but some states like Oregon and Washington allow physician-assisted suicide. Canada has legalized medical assistance in dying, reflecting a growing acceptance of the practice under specific conditions. In Asian cultures, in Japan, euthanasia is illegal, but there is some public support for it, particularly in cases of terminal illness. The cultural emphasis on family and societal harmony influences attitudes towards end-of-life decisions. In India, euthanasia is illegal, and the cultural and religious values, particularly Hinduism and Islam, generally oppose it. The focus is often on palliative care and the sanctity of life. Religious perspectives also play a significant role. In Christianity, most Christian denominations, including Catholicism, oppose euthanasia, viewing it as morally wrong and contrary to the sanctity of life. However, there are some liberal Christian groups that support it under certain conditions. In Islam, euthanasia is generally prohibited as life is considered sacred and only Allah has the authority to take it away. Suffering is often seen as a test of faith. In Hinduism, the religion traditionally opposes euthanasia, emphasizing the sanctity of life and the belief in karma and reincarnation. However, there are diverse views within the religion, and some may support it in cases of extreme suffering. In Buddhism, the religion generally opposes euthanasia, as it contradicts the principle of non-harm or ahimsa. However, attitudes can vary, and some Buddhists may support it if it alleviates suffering. In many African cultures, euthanasia is not widely accepted, and traditional beliefs often emphasize the sanctity of life and communal decision-making. The focus is usually on providing care and support for the dying. These perspectives highlight the diversity of views on euthanasia across different cultures and religions. The debate continues to evolve as societies grapple with ethical, legal, and personal considerations. What are your thoughts on how cultural values influence views on euthanasia? Euthanasia can be administered to individuals with psychiatric suffering in some jurisdictions, but it is a highly controversial and complex issue. Here are some key points. 1. Netherlands and Belgium. These countries allow euthanasia for patients with severe psychiatric conditions under strict conditions. The patient must demonstrate unbearable suffering with no prospect of improvement, and multiple assessments by independent psychiatrists are required to confirm the diagnosis and the patient's decision-making capacity. 2. Canada. Medical assistance in dying or MAID is legal in Canada, and recent changes have expanded eligibility to include individuals with mental illness, although this will come into effect in March 2023. The process involves rigorous safeguards to ensure that the decision is well considered and voluntary. 3. Other countries. In most other countries where euthanasia or assisted suicide is legal, it is typically restricted to those with terminal physical illnesses. The inclusion of psychiatric conditions remains a contentious issue due to concerns about the patient's ability to make an informed decision and the potential for treatable conditions. The debate around euthanasia for psychiatric suffering centers on ethical, medical, and legal considerations. Proponents argue that individuals with severe treatment-resistant psychiatric conditions should have the same right to choose a dignified death as those with physical ailments. Opponents, however, worry about the potential for abuse and the challenges in ensuring truly informed consent. What are your thoughts on this complex issue? The medications used in euthanasia are carefully chosen to ensure a peaceful and painless death. Here's how they affect the body. Barbiturates like pentobarbital, secobarbital. These drugs depress the central nervous system, leading to deep unconsciousness. They induce sleep within minutes, followed by a coma. In high doses, they suppress the brain's ability to regulate breathing and heart function, leading to respiratory arrest and cardiac arrest. Benzodiazepines like midazolam, diazepam. These drugs have sedative and anxiolytic or anxiety-reducing properties. They help calm the patient and reduce anxiety before the administration of the lethal dose. They also enhance the effects of barbiturates by further depressing the central nervous system. Neuromuscular blocking agents like rocuronium. These drugs cause paralysis of the muscles, including those necessary for breathing. They ensure that the patient does not experience any involuntary movements or distress during the process. By paralyzing the respiratory muscles, they lead to respiratory arrest. Opioids like morphine. These drugs provide potent pain relief and sedation. They help manage any pain and ensure the patient remains comfortable. In high doses, opioids can also depress respiratory function. Propofol. This anesthetic induces rapid unconsciousness. It is used to quickly render the patient unconscious, ensuring they do not experience any discomfort or awareness during the administration of other medications. The combination of these medications ensures that the patient transitions from consciousness to unconsciousness smoothly and painlessly, followed by a cessation of vital functions. The process is designed to be humane and dignified, minimizing any potential for distress or suffering. While euthanasia is designed to be a peaceful and painless process, there are potential risks and complications associated with the medications used. Here are some of the key issues. 1. Prolonged death. In some cases, the dying process can take longer than expected. Patients may become unconscious quickly, but the actual time to death can extend to several hours or even longer. 2. Incomplete efficacy. There have been instances where the medications did not work as intended, leading to the patient regaining consciousness or experiencing distress before death. This can be particularly traumatic for both the patient and their loved ones. 3. Adverse reactions. Some patients may experience adverse reactions to the medications, such as nausea, vomiting, or seizures, before becoming unconscious. 4. Technical errors. Errors in administering the correct dosage or combination of medications can lead to complications. This includes issues like incorrect drug preparation or administration techniques. 5. Ethical and legal concerns. In cases where complications arise, there can be significant ethical and legal implications. Healthcare providers must navigate these challenges carefully to ensure compliance with legal standards and ethical guidelines. 6. Emotional impact. The emotional and psychological impact on healthcare providers and family members witnessing the process can be profound, especially if complications occur. These risks highlight the importance of strict protocols, thorough training for healthcare providers, and comprehensive patient assessments to minimize complications and ensure a dignified and peaceful death. Yes, there have been instances where euthanasia did not go as planned. Here are a couple of notable cases. 1. Failed euthanasia in Belgium in 2018. A Belgian woman named Marieke Vervoort, who had a degenerative muscle disease, opted for euthanasia. However, the initial attempt failed and she had to undergo a second procedure to end her life. This case highlighted the complexities and potential challenges in administering euthanasia. 2. Dutch dementia case. A Dutch doctor faced trial for performing euthanasia on a 74-year-old patient with severe dementia. The patient had previously expressed a wish to be euthanized, but also indicated she wanted to decide the timing. The doctor administered a sedative in the patient's coffee, but the patient woke up and had to be restrained by family members while the doctor completed the procedure. This case raised significant ethical and legal questions about consent and the process of euthanasia. These examples illustrate the potential difficulties and ethical dilemmas that can arise in the practice of euthanasia. They underscore the importance of strict regulations and thorough assessments to ensure that euthanasia is administered ethically and effectively. To prevent failed euthanasia cases and ensure the process is carried out ethically and safely, various jurisdictions have implemented strict safeguards. Here are some common measures. Explicit consent. The patient must provide explicit, voluntary, and informed consent. This often involves multiple confirmations over a period of time to ensure the decision is consistent and not made impulsively. 2. Second opinion. A second independent physician must review the case and confirm that the patient meets all the criteria for euthanasia. This helps ensure that the decision is medically and ethically sound. 3. Psychological evaluation. In cases where there is any doubt about the patient's mental capacity, a psychological evaluation is required to confirm that the patient is capable of making an informed decision. 4. Documentation and reporting. Detailed documentation of the entire process is mandatory. This includes the patient's request, the assessments by physicians, and the administration of euthanasia. All cases must be reported to a regulatory body for review. 5. Strict criteria. Patients must meet specific criteria, such as having a terminal illness with a prognosis of a limited time to live, experiencing unbearable suffering, and having no reasonable alternatives for relief. 6. Waiting period. Many jurisdictions require a waiting period between the initial request and the administration of euthanasia. This allows time for the patient to reconsider their decision. 7. Supervised administration. Euthanasia must be administered by a qualified healthcare professional to ensure it is done correctly and safely. 8. Review committees. Some regions have established review committees that retrospectively examine all euthanasia cases to ensure compliance with legal and ethical standards. These safeguards are designed to protect patients, ensure ethical practices, and prevent potential abuses or failures in the euthanasia process. What are your thoughts on these safeguards? Implementing and enforcing safeguards for euthanasia involves several challenges, including ethical, legal, and practical issues. Here are some key challenges. 1. Ensuring informed consent. Verifying that a patient's consent is fully informed and voluntary can be difficult, especially in cases involving severe pain, psychological distress, or cognitive impairments. Ensuring that patients are not influenced by external pressures is crucial. 2. Assessing mental capacity. Determining a patient's mental capacity to make an informed decision about euthanasia is complex. Mental health evaluations must be thorough, but there can be variability in assessments and some conditions may fluctuate over time. 3. Consistency in application. Ensuring that all healthcare providers consistently apply the criteria and procedures for euthanasia can be challenging. Differences in interpretation and application of the law can lead to inconsistencies and potential abuses. 4. Training and support for healthcare providers. Healthcare professionals need adequate training to handle euthanasia requests ethically and compassionately. They also require support to deal with the emotional and psychological impact of participating in euthanasia. 5. Regulatory oversight. Effective oversight requires robust regulatory frameworks and resources, ensuring that all cases are thoroughly reviewed and that any deviations from the law are addressed promptly is essential but can be resource-intensive. 6. Cultural and ethical diversity. Different cultural and ethical perspectives on euthanasia can complicate the implementation of safeguards. Balancing respect for diverse values with the need for consistent legal standards is a significant challenge. 7. Preventing coercion and abuse. Safeguards must be in place to prevent coercion and abuse, particularly for vulnerable populations such as the elderly, disabled, or those with mental health issues. Ensuring that decisions are made freely and without undue influence is critical. 8. Legal and ethical ambiguities. The legal and ethical landscape of euthanasia is complex and evolving. Ambiguities in the law can lead to uncertainties in practice, making it difficult to enforce safeguards consistently. These challenges highlight the need for careful consideration and ongoing evaluation of euthanasia laws and practices to ensure they are implemented ethically and effectively. What are your thoughts on these challenges?